Imagine being at a public place and not be able to control your stool. 1 in 12 US adults will suffer from something called fecal or anal incontinence, and you can imagine how debilitating and traumatizing it can be for those patients. But the good news is there is help, and today we're going to be discussing all about it. Hello everyone, this is Dr. Nabila Noor. I'm a board-certified and fellowship-trained urogynecologist and pelvic reconstructive surgeon, and welcome back to the channel. So fecal incontinence or anal incontinence is the involuntary loss of gas, liquid stool, and solid stool. There could be a whole host of reasons of why this may happen, and it's useful to categorize them into different categories. For example, there could be things such as anatomical factors. So these could be because of sphincter injury from childbirth, patients who may have had any kind of surgery, especially in the rectoanal area. Things like hemorrhoids or rectal prolapse. So rectal prolapse is where the rectum can push through the anal opening. Age is a risk factor, as well as trauma in the pelvic area in general. There could be factors that can affect the stool consistency or the stool volume. For example, diarrhea or constipation that can lead to stool impaction. Stool impaction is when the stool is so hard that it's hard to get it out. And as a result, it causes the anal sphincter muscles to relax, which makes the liquid stool pass through this opening. There could be factors such as any kind of health-related problems that patients may have that can affect the nervous system. For example, stroke, dementia, spinal cord injury, multiple sclerosis, uncontrolled or poorly controlled diabetes. There are also things that can affect the rectal compliance, so diseases such as inflammatory bowel disease, things like Crohn's disease, ulcerative colitis, radiation-related proctitis. So any of those factors can cause women or cause patients to have what we call fecal incontinence or anal incontinence. So when I have a patient that comes to my office with these complaints, the first thing I do is start with a good history and a good physical exam. And usually this is enough for me to get a good understanding of what may be the reason for their fecal incontinence. Because as you can imagine, the treatment for fecal incontinence a lot of the times depends on what the etiology of their issue is. If somebody is having leakage of stool because of trauma from childbirth, that's a very different patient than somebody who is leaking stool because of chronic inflammatory diseases such as Crohn's disease or ulcerative colitis. So that is an important factor to take into consideration. In general, though, when we're thinking about treatment options for fecal incontinence, we always start with the less invasive conservative option and then go on to something more invasive. When we talk about less invasive conservative options, we focus a lot in improving the stool consistency as well as stool volume. Stool consistency because gas is much harder to control than liquid stool, which is much harder to control than solid stool. So if I have a patient in my office, and usually this is what I hear, that their stool is a little bit on the softer side. So we talk about things that they can do to help improve the consistency of the stool. In general, the recommendations are to have at least 25 to 30 grams of fibers in your diet. And just doing fruits and vegetables often is not enough to get you that amount of fiber. So I'll talk to patients about doing some fiber supplements. There are lots of different options that's available over the counter, so usually I'll tell patients to try a few different kinds, see which one they like. Make sure that they're not doing a lot of fiber at one go, because sometimes that can cause bloating and cause patients to have other issues, but slowly increasing the dosage can be helpful. Another important thing to remember, especially if you're 45 or above, is to make sure you're up to date on your colonoscopy, because you don't want to miss a colonic pathology, specifically cancer, that could be causing some of your symptoms. We also talk about avoiding foods that can cause diarrhea or cause the stool to soften. Things such as greasy food, fatty foods, for those who are lactose intolerant, avoiding dairy products, caffeinated beverages, spicy food for some patients as well. And also, whenever possible, doing smaller meals as opposed to one large meal, because doing a large meal can cause patients to have the urge to have a bowel movement and sometimes can cause diarrhea. Breaking their meals down to smaller and more frequent meals can help with the stool volume. One of the most successful surgical interventions that we have for patients with fecal incontinence is something called sacral neuromodulation. It's FDA approved and has been shown to have amazing results in patients who are suffering from fecal incontinence. What it is, it's a small device that we implant into patients' back, which almost looks like a little pacemaker. And what it does is it regulates the nerves that's controlling the bowel movement, and it can affect the signaling that's happening between your bowel and the brain. The amazing thing about this device is that it's also FDA approved for conditions such as urinary incontinence, especially with urgency, as well as urinary retention. And a lot of my patients who have fecal incontinence also have urinary symptoms, so it's really helpful when I can do one treatment and help improve both the symptoms of fecal incontinence as well as urinary incontinence. If this is something that you think might be helpful or you're interested to learn about it, talk to your doctor, have them refer you to a specialist who does these procedures so we can talk to you about these different options, and if you're a candidate, offer you the treatment as well. Hope you found this video helpful, and if you did, please subscribe and share it with those who may need it, and I hope to see you soon. Bye!